Alrighty, folks. Very good evening to you. Um, this is Youth Zoom with a difference. Yes, we're twisting things up just for this month. As I said in the opening of the program at 7 o'clock, that this month it's quite busy. Right, lots of activities. Talking about Breast Cancer Awareness Month. We're talking about Lupus Awareness Month, Mental Health Awareness Day. I think that's coming up on October 10, and Oral Health Month. So it's a busy month. And so October is Oral Health Month. And so we ask that you stick with us and share the excitement as we take you through, you know, the different challenges that people go through orally and how we can assist. And so there's a theme for this month, and it is be proud of your month for happiness and well being. And as we all know, a healthy mouth can mean a healthy body. And so I got my friend with me, no stranger. Um, we had our moment on a Tuesday at 8:30, so it's a Friday and it's Youth Zoom. Dr. Dayna, welcome. How are you doing, my friend?
Hi, Chevauni. Can you hear me?
Loud and clear.
Okay, good. I'm doing well. It's interesting to be here on a Friday night.
I know, quite
Almost the
nostalgic,
bedtime,
isn't it?
but I am here.
Yeah, it's quite different. It's nostalgic. It's bringing me back to a Tuesday.
Yes,
And
I miss
so
Tuesdays.
I miss Tuesdays as well. But we're catching up, and so we're helping our listeners to sort of go through this month. And I'm really happy that you are here, to sort of guide the process. You are just the best. This is Dr. Dana from Pure Smiles, folks. And so, as I said, the theme for this month is be proud of your mouth for happiness and well-being. And so we are super, super happy that you're here. So, why aren't people proud of their mouth? I think that's a good place to start, Dr. Dana.
Well, where to start? I think a lot of persons are focused on having the perfect mouth and not having a healthy mouth.
Right.
And that is what really matters. You know, the first impression that you get most times are people's smile, right?
Yeah.
That's the
Right.
first thing that persons notice. If you have a missing tooth, your
Mm-hmm.
teeth crooked, or something going on, people notice that, and it affects person's confidence.
Mm-hmm.
And on top of that, if you have bad breath, it's like Baygon, the human Baygon, a human repellent.
Mm-hmm.
So, there are lots of reasons why persons aren't proud of their mouth. It could just be the way their teeth look. They think that they don't smile well. They may be struggling with bad breath, and or they could have a
Mm-hmm.
healthy mouth, but they may think that, oh well, my mouth is not perfect. So,
Right. Right.
I'm not proud of my mouth. I'm not proud of my smile. And, especially with the mask
Mm-hmm.
coming up from COVID, people have found a perfect way to hide their smile,
Right.
to push oral health aside. And so now, we are really encouraging persons to be proud of their mouth.
I'm gonna stick with the point of being proud. So what can help people to be proud of their mouth? Put it that way. What can
Okay.
sort of help them to be happy, to be proud, of their mouth?
Okay. So, first things first is to remember that oral health is important to our general health. So,
Mm-hmm.
just as how you take care of your body, it's very important for you to take care of your teeth. You know what I find, Shimoni? And I guess I've been in this for quite a number of years now.
Yeah.
But something that has been standing out like a sore thumb to me lately is if a patient goes to their medical doctor
Mm-hmm.
and they say to them, boy, Miss Brown, I see a little suspicious spot right here on your arm, Miss Brown is going to fly, go do x-ray, anything the doctor told her to do, x-ray,
Yeah.
blood test, check up at a next specialist, this scan, that. And if the doctor ends up telling Miss Brown, well, we're going to have to amputate your arm so that you can still have life, Miss Brown is going to do it.
Right.
However, They come to the dentist and they hear, well, we see the suspicious spot on your tooth, and we don't see them again
Yeah.
until they start to have pain when it's
True.
gone way
True.
bad,
True.
or when their tooth looking black now or the tooth
Yeah.
shaking. They don't really, you could talk to thy kingdom come. They're
Mhm.
not coming back, right? But what I try to encourage patients in now more than ever, it's something that I usually say, oh, yes, your oral health is important to your general health.
Right.
But now I'm realizing this trend.
Mhm.
And I don't know if it's a Jamaican trend or a worldwide trend where we're just not going to go to the dentist until we're feeling that pain. So it's important because oral health can show you signs and symptoms of other diseases that may be happening in your body, whether it's diabetes, if you have heart problems, and also, oral cancer can develop. You can get cancer in
Mhm.
your mouth. And for women who are pregnant, if you have poor oral health, it can lead to preterm labor. So there's
Mhm.
a lot of other issues that you can develop from having poor oral health. But most times, when you do have a general disease, it does manifest in your mouth first. So it's very important to take care of your mouth.
So oral health is linked to general health.
General health.
That's pretty much what it is.
Right.
Um, and so it links with the theme of this. You're talking about well-being and everything. Um, well, let's turn attention to acids. How can you protect the teeth from acids?
Okay, so the first thing is, Shivani, what's your favorite drink?
Um, what's my favorite drink?
It should be rolling off your tongue.
Um, let's say orange juice.
Orange juice.
Let's say orange juice. Right.
Orange juice. You gotta choose an acidic juice.
Um, what isn't the citrus type of acidic?
Yes, but what about water?
Oh, right. Oh, oh, right. Okay. Well, talk to us.
Well, water is very important for
It
your teeth
is.
and to help you to prevent your teeth from acids, right?
Right.
So the brain develops a chemical dependency on sweets, caffeine, alcoholic beverages that we drink.
Mhm.
And so you notice that when you're drinking them a lot, you just crave it more. And a common one is Pepsi. Some
Mm.
persons will say, boy, doc, I can't do it without my Pepsi. But the Pepsi has both the caffeine and the sugar, and
Yeah.
you can't get to do without it. And what happens is that it's acidic, sticking on your teeth, it's breaking down your enamel, allowing the food and everything else to stick on your teeth much more easier, and in turn breaking it down. But the good old H2O, right, will help to wash your teeth away and to cleanse it. It's a neutral, it's neutral on the pH. I don't think it's called meter. I can't remember the name of it, but it has a neutral pH, and so it's wonderful for your teeth. And
Mhm.
also, our body is at least 70% water, right? So we want to ensure that we are not being dehydrated, starting with our mouth.
So drink more water.
Drink more water, Shivani, not more orange juice. Orange juice is good for the vitamin C, but not more orange juice. Drink more water.
What about sugar-free gum?
Sugar-free gum is good. However, we have to be mindful of the brands
Mhm.
because nowadays, for the sales, you're seeing slapped on the label
Yeah.
sugar-free. And you
Sugar-free.
turn around the back and you see aspartame and you're seeing all of these refined sugars
Mhm.
embedded in the gum. So,
Mm.
in turn, and refined sugars are very hard to break down, and they're also even more damaging for your teeth. So, you want to remember that sugar free doesn't necessarily mean that it's healthy, right? So, just like how we see fat
Diet.
free or
Right.
diet, yes, I was trying to remember diet Coke
Diet Coke.
or
Yeah.
diet this, diet that.
Yeah.
It
Yeah.
doesn't mean that it's healthy. So
Mhm.
when it comes to acidic drinks, you want to ensure that you are not just paying attention to sugar free or this free, because even though it may not contain, certain
Mhm.
carbohydrates, they have a lot of acids that help to preserve the product, right? That
Mhm.
helps to give it that nice, fresh, fizzy taste and when you open it, you hear that's actually the acid getting
Yeah.
released.
Yeah. And so, well, talk to us about considering testing your saliva pH. What's that all about?
Okay, so with testing your saliva pH, you have these certain test strips that are pretty much easy to purchase to
Mm-hmm.
help to monitor your oral pH, right?
Mm-hmm.
So you want to try and keep your pH in your mouth less acidic.
Mm-hmm.
So anything that's below a 4 on the pH meter means that it's acidic, right?
Mm-hmm.
So you want to evaluate your diet. So this will be something that you talk with your healthcare professional with. It's
Yeah.
very important before you just go, well, I'm taking the pH stick and boy, I think my mouth is very acidic or I think my mouth is fine. It's
Mm-hmm.
very important that you visit your dentist so you can have a talk about this. Because if you are someone who consumes a lot of orange juice, no shade, Chevauni,
I
or
will.
or like you drink, or I know there are these diets out there where the first thing you get up in the morning you're having some apple cider vinegar,
Right.
or you just eat a lot of uh, fruits that are acidic, because some
Mm-hmm.
fruits are acidic,
Mm-hmm.
or you eat a lot of junk food or refined sugars, it's going to increase your acidic content in your mouth. Also, if you're using mouthwashes that have a high alcohol content, it
Right.
will cause your mouth to become more acidic. So you want to ensure that you are monitoring your diet, monitoring the pH, and also talking to your oral health care professional
Mm-hmm.
about this.
Mm-hmm. So it's very important for us to manage um, the things we're putting in our mouth, in turn the body,
Yes.
um, and so it's sort of a way to protect everything. So manage our drink. So drink more water.
Drink more
Um,
water.
drink more water. I know you're big on flossing. I know that for a fact. So drink more water. Limit your exposure time, and even though it says diet free or sugar free, it's not necessarily healthy, right?
Right.
So we just need to bear that in mind. And just a general reminder that oral health is linked to general health. So the same procedure you take when you're visiting your GP is the same you should take when you're visiting your dentist. So
Right. But you also forgot one main one,
what's that?
which is waiting to brush your teeth after consuming the acids.
Mm.
Right.
Talk to us about that. So if we can't brush immediately, so we rinse,
So we rinse. We
right?
rinse with the good old water. So we
Right.
don't brush right after. We want to give it at least half an hour
Mm-hmm.
before we go ahead and brush. Why? Because your mouth is still working to
Mm-hmm.
bring the pH back down after you've eaten the food.
Yeah.
And so the saliva is basically creating this buffer. So when you go and disrupt its cycle now, it ends up making the environment in the mouth much more acidic. So we still want to wait, and you're
Mm-hmm.
like, huh, doc, but I'm supposed to brush my teeth right after the meal and I don't want to have a bad breath. Just rinse with some water and you wait the time and you'll be good to go.
Right. So don't brush too much. Brushing
Don't
too
brush
much,
too much.
right?
Right. Twice a day is
Yeah.
fine with a soft toothbrush,
Mm-hmm.
not up and down movements or side to side, but in round circular motions. So
Right.
you're brushing it twice a day, you're flossing with the waxed floss,
Mm-hmm.
and you're also using an alcohol free mouthwash. And we ensuring that our diet is up to par. So we
Right.
want to cut back on the acids. Remember, fruits also have natural sugars in them. So we try to rinse after we have the fruit with some water, of course, and we
Mm-hmm.
be mindful of what we're eating overall. And if you wouldn't eat it because it's probably going to be bad for your stomach, then even worse for your teeth,
That's
right?
acid reflux we're talking about, right?
Right, acid
Right.
reflux.
Right.
So, and which is also another reason why persons do develop cavities,
Right.
because it's one tract. Your
Mm-hmm.
mouth goes right you chew the food and it goes
Right.
right down your esophagus into your stomach. So you go and eat this acidic food, or you're eating late at night and you're not fully digesting. When you lie down, it does come back up into your mouth, right? And
Right.
it can also cause bad breath, because most persons who do have acid reflux, or the
Mm-hmm.
more uncontrolled version, which is GERD,
Right.
they do tend to develop bad breath over a period of time.
Mm. So I say somebody saying Gene Watson says I drink a glass of water every morning as I wake up.
right? That is good for digestion. And it's
Mm.
good to reset your body first thing in the morning with some water, because
That's it.
also we have a lot of mouth breathers, and some of us don't even know that we're mouth breathers. So
Mhm.
your mouth is open, and it's all this air is coming in. You wake up in the morning, your throat is dry, and some some people may think, oh my gosh, I woke up with COVID this morning. But no, you just need a glass of water, right? Just have a glass of water, room
Yeah.
temperature water.
Yeah, very good. So we pick up next week because the conversation continues. It's Oral Health Month, and I had to draw my friend with me tonight. I see Shan online watching. Hey, Shan! Chantal Richards is also on. So Dr. Dana from Pure Smiles. Give us all
Patient.
the details. How can we find you? Just remind the people. It's been a minute, so bring us up to date.
Let me refresh you guys'
Give
memory.
us
So
a
you can
refresher.
find us at Unit 12 Barbican Business Center, 88 Barbican Road. And you can find us online at www.puresmilesjamaica.com. And on social media, you can find us at Pure Smiles JA. And our phone number is 667-1694.
It's your anniversary month too, isn't it?
Yes, so this year we are celebrating 5 years
Oh,
of
look at
Pure
that.
Smiles. Yes, it's our year of grace. Bless the Lord. And so we will be celebrating that next week, Wednesday.
Oh,
And so we are looking forward to that.
yeah.
And yes, I know Shannon will be looking forward to lunch. I am
She
too.
says, "Hey."
That is how we celebrate in the office. And
Yeah.
usually we do give away a prize or a
Mhm.
gift to our patient that has been, the most consistent.
Yeah.
So if you are a patient and you're listening out, listen out for your call, because you won't know who it is until you get that call. But that
Yeah.
is something that we do to celebrate our patients who
Yeah.
have been with us, whether from 2017 or even this year.
Mhm.
It has truly been a blessing.
Oh, I'm quite happy. I'm really proud of you, and I'm celebrating with you too.
Thank you, Chevauni. Thank you. Thank you.
Thanks, my friend. Catch up with you next week. Have a great weekend.
Yes.
Appreciate it.
Okay. Bye.
Great. That's Dr. Dana, folks, the preaching dentist. We're talking about Oral Health Month. Yeah, trust me. It's very important to keep the conversation going. Be proud of your mouth for happiness and well-being. And just be aware of some of the things you put in your mouth. Yeah, cut back on some of the juice, drink more water, and sort of keep that same energy alive. The energy of like visiting the doctor on a regular. You visit the dentist regular too, and do your checkup and keep on top of things. So guess what? We'll continue the conversation next week for sure, and yeah, we'll tell you all about the things you need to know as we celebrate Oral Health Month 2022, as well as celebrating with our friends at Pure Smiles. Hey, they turn 5 next week, and we're so happy for them. Can you imagine? Really, really nice. This is Love 101, folks, and it's the family.